morning, I'm Dr. Alfonso Gabriel A. Vega, Vitreoretina Specialist in Davao Doctors, and I'm here to talk to you about age-related macular degeneration. Age-related macular degeneration is by far one of the most common causes of irreversible central visual loss in older patients. It basically consists of two types, one being dry type of macular degeneration and the other being a wet type of macular degeneration. Now, if you would ask how would we differentiate between the two, there's a little bit of a difference in how they would present. Basically, in dry type of of macular degeneration, you notice a steady and a gradual loss of vision which happens in years. Okay, whereas in a wet type of macular degeneration, you notice the sudden change in your vision. Okay, the risk factors for these problems are basically related to age and lifestyle. So number one would be your age. Other risk factors that are also involved would be your diet. If your diet consists of something that is lacking in omega-3s or green leafy vegetables, as well as smoking and obesity. These factors are the ones that are usually correlated with a decrease in the antioxidants in the body per se. How do we diagnose these conditions? These conditions can be diagnosed basically through three types of examinations. The number one being dilated retina exam by your retina specialist. The specialist would look for certain things inside the eye, such as deposits of byproducts of metabolism inside, which we call drusen, areas of atrophy in your center of vision, as well as if it does progress to the wet type, we look for scarring and blood inside or hemorrhages inside your center of vision. Other more specific diagnostic exams that we use in diagnosing and prognosticating these conditions would be your fluorescein angiography and your optical coherence tomography, both of which are available in our eye center. One is invasive versus the other is non-invasive. Treatment for these conditions would they would differ. If you're diagnosed with dry AMD or dry age-related macular degeneration, what we can do is to give you supplementation of vitamins and antioxidants that aim to reduce the risk of you developing severe types of dry AMD or it converting to wet AMD by 25%. Whereas if you have your wet AMD, we typically give injections inside the eye to stop the growth of these abnormal vessels that cause the bleeding in the first place. Now, you might ask kung ano yung prognosis or how well will your vision be after. It depends, okay? Typically, in dry AMD, ang patients would complain, they would always say that their center of vision is preserved more or less compared to your wet AMD. But specifically for wet types of AMD, the earlier we catch you, the earlier we see that there's a problem, the better your prognosis will be, the better the outcome of your vision will be after treatment. So I always advise patients to look for two things, okay, every day to monitor. When I see that they're beginning to have a dry type of AMD, I always ask them to check every day for each eye to check if there is a distortion in straight lines that they see, or if there is a defect in your central vision. I describe it as like a a dark spot. When you try to look at the face, you see a dark spot in the middle. Okay? You do that every day, and when you see changes, you come straight to me. Thank you very much for listening to our small talk today regarding macular degeneration. If you have those symptoms that I described a while ago, please come to your friendly ophthalmologist so that they can do the examination on you and help us help you preserve your vision. Thank you.